I'm Sean Summeril. I'm from here. I wasn't born here, but I was essentially raised here. I am married and we have 4 kids of varying age. Oldest is currently 16, soon to be 17. My youngest just turned 9. Sometimes you can get bit by a bug and you might not have any type of reaction. Sometimes you might see a small little mark, and then other times, depending upon the person, you might go ahead and see some redness, a little bit more redness, and then some kids who are a little bit more reactive to these bites might even have a fair amount of swelling that can be associated with these bites as well. And all of that is pretty common and pretty normal to see with bites, especially during this time of the year. So depending upon when you see the bite, so if you see the bite pretty quickly, if you want to, you can go ahead and use soap and water to kind of clean it off. And then afterwards, depends on what happens with the bite. If it doesn't do a whole lot of anything, then you probably don't need to do much at that point. But if it does become more red, hot, swollen, you could use ice or ice packs on it to try and cool it down. Sometimes you can even use some hydrocortisone if it seems like it's itchy on the bite as well. So sometimes with the bites, you will see those that are more reactive, they may get more hot and more red and more swollen. A lot of times that's probably just more of what we call a local reaction or a typical reaction to a bite. As I mentioned, some kids may have that more commonly than others. You may even have a little bit of pain. A lot of times the swelling is going to be more soft, swollen, but if it becomes more hot and red and firm with a lot more pain or any type of streaking of the bite going up the arm, that may be more concerning, that at some point it's gone from just your typical reaction of a bite to maybe having gotten a secondary infection. A lot of times you're not going to see that necessarily happen right at first. A secondary reaction would be something that might happen a few days after that happens, even anywhere between 5 to 7 days. So a lot of people that may be out in the woods may come across different areas that can have ticks. A lot of times you don't even know necessarily that you have a tick until you do an inspection. So if you're out in the woods, afterwards you may want to take a look at your body, see if there's any ticks there. There's lots of things out there about how to get the tick off of your body. And most of these ticks are going to be usually your wood ticks that you're talking about. And so the best way to get a tick off is if you have a pair of tweezers, take the tweezers, grab as close to the head as you can, which will be where the tick is attached to your skin, and then take that and apply steady pressure and pull out or upwards, and usually that's enough to get the tick off. Sometimes the tick may even come off with a piece of your skin. That's okay. So a lot of times if you can't get all the tick off, some people then may try and dig it out. Get as much as you can. You don't necessarily need to dig the tick out. Just leave what's there, and eventually your body's going to expel it itself now that the tick's been essentially killed. So mosquitoes are going to probably be one of your most common insect bites. They're all going to itch, at least for the most part. Some people get bit a lot, others not as much. So if you want to, certainly can go ahead and use ice, especially if some mosquito bites get bigger and larger. And sometimes you can get a fair amount of swelling. So a lot of times infection is not going to happen immediately. That would be extremely quick. There's always exceptions to that rule, but a lot of times it's going to be more the reaction to the bite. For a secondary infection to that area, you'd worry that it gets maybe swollen and hot. Maybe it's not firm, but when it becomes more firm and a lot more painful, then we're going to be worried more about infection. I always tell parents though, if you call and you're worried because it is red, hot, and swollen and you want to make sure that it's not infected or is infected, I always encourage them, if they need to, that are concerned about, come into the clinic and let us take a look at it to make sure that it hasn't gone from just a normal reaction that you can see from it to a secondary infection at that point. So spider bites. A lot of times you're going to see more pain when you get by a spider, but that doesn't always happen. So it's really hard to differentiate in some instances a spider bite from other insect bites. And oftentimes with a spider bite, a lot of people worry about them causing an infection and whatnot. A lot of times it ends up being the same thing as with other insects where it doesn't get infected. Maybe you have a local reaction, a little bit of redness to it, but you don't have that infection. Some spiders can be worse than others, such as the brown recluse spiders or the black widow spiders. Once again, oftentimes you see some pain with that, but doesn't necessarily have to have pain. But sometimes you can see worsening of the skin with more redness, pain with those, which would be concerning that it's gone from being a normal reaction to whatever type of bite that it may have been more to becoming an infection at that point, which time you definitely want to come in and get that evaluated. So the most recommended is going to be any type of insect repellent that has DEET in it. That tends to be the best, especially when you're up in the woods for ticks, mosquitoes, etc. For those people that may not want to use DEET, or maybe that causes more reaction to their skin, one of the other ones is any type of insect repellent that has picaridin in it. And that is another type. Some people like that because they feel like it tends to be a little more softer on their skin. Those are going to be your two best options as far as insect repellents are concerned. There are other ones out there as well. For instance, some that have citrulline and whatnot. They're not nearly as effective as either the DEET or the picaridin type of insect repellents.